Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and drraghavamedicaldoubts.in. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatments and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the management of heart disease in pregnancy. Management of heart disease in pregnancy is a complicated problem as compared to non-pregnant patient. Diagnosis also is difficult due to the altered hemodynamics. During pregnancy, the blood volume increases by 25 to 50% due to retention of sodium by the body owing to the hormones. The cardiac output also increases according to the demand by the body as the mean blood pressure is not altered. The work of the heart must be correspondingly increased. Slight enlargement of the heart is present from the increased blood volume. Normal heart has no untoward effects during pregnancy, but may inflict great burden on the diseased heart. About 70% of the heart problems are due to the rheumatic fever, rheumatic heart disease and mitral stenosis. Rest of the diseases may be due to congenital causes and hypertension. It is important to emphasize that any assessment based on the severity of symptoms is unreliable and potentially dangerous. A woman with mitral stenosis may be symptomless in early pregnancy but may become serious due to the pulmonary edema in later months. Severity should be assessed on objective grounds. In these days of planned families, the opportunity may be provided of giving advice before the woman becomes pregnant. If signs of heart failure are present or have at any time been present, pregnancy is not advisable till the valvotomy is successfully performed. This rule is applicable through the failure, though the failure is controlled as the risk will be considered to both mother and the child. Only exception is the husband and wife are very anxious to have children. Both are willing to take the risk, but there must be good cardiac compensation. Active rheumatic fever and infective endocarditis are absolute contraindications. The patient of mitral stenosis, if there is no heart failure, abnormal rhythm, dyspnea, enlargement of heart, signs of tight stenosis, and if the patient can be kept under close observation, then there is a little added risk from pregnancy to the patient. Women with rheumatic heart disease should be advised to plan their pregnancies when they are young. They are discouraged to have more than 2 children. Most women with rheumatic mitral disease tend to develop atrial fibrillation by the age of 35 to 40. And the combination of fibrillation and the extra work entailed in looking after the toddler may be serious. Economic factors are most important in that domestic help will allow the mother for more adequate rest. Natural delivery is safer than the cesarean section in heart disease. Under medical supervision and treatment, continuation to term or until the child is viable and labor can be induced usually preferable is to be judged. The best safeguard is the repeated observation. The progression of the doubtful or manifest of signs of cardiac failure may be detected at an early stage and an appropriate treatment is started. Here a period of bed rest is important. Domestic help is arranged and if possible, and extra result is advisable during day. Digital is diuretics and salt restriction is indicated if heart failure is present. Acute respiratory infections should be promptly treated as, as they may precipitate cardiac failure. If necessary, mitral valvotomy may be performed during pregnancy, but it is rarely required if adequate medical treatment is given. A postpartum injection of ergotamine is dangerous if heart failure is present. Pulmonary edema may result from the consequent increase in circulating blood volume. The periods of greatest danger are the last 3 months and the first 2 days after delivery. At these times, cardiac failure is liable to occur. That's all about the heart disease during pregnancy. In the next video, I will discuss about some other disease. Thank you.